My name is Victoria Alexander. I'm an ENT consultant. I currently work full time in the NHS. That's at Epsom St Helier Hospital, which is in Greater London. I do general ENT and also my subspecialty otology in that place. And I also work at St George's University, which is a tertiary hospital, and I just do otology at that hospital. I think reality is, and it's still true today, even though it's like 15 years or maybe longer than that now since I qualified. Was realistically, is that still desire to help other people? And that does seem still quite naive, but at the core of it, it's because I still care and I still want to do the best for my patients. And when it works and it goes really well, it's actually enjoyable to feel that you've changed someone's life for the better. So ENT is great because it's a mixture of mainly outpatient clinics and theatre space, but you also get to see a wide range of different types of people. So I'm not just dealing with older adults or middle-aged adults. I also deal with children, a whole spectrum of different specialties. So that was people rather. So that's why I went into ENT. It also, the practicality of it, particularly otology, it's really fine work. It really, when I'm operating, I don't hear or see anything for 6 hours or 4 hours when I'm there. It's total focus, and it's an enjoyable job from that side of things. The range of different conditions as well that I can see is also really broad, which is very different from, for example, general surgery and neurosurgery. That's why I chose A&T. For me, my most rewarding part is when for example, I'm an otologist, so a lot of patients I see have really leaking, infected ears, or they have hearing loss. So when I can give them a dry ear and I can improve their hearing, it's life changing for them. They can feel more confident. They lose their social stigma. They can improve their access to kind of social situations as well. And the other element that I sometimes see is balance disorders. So when I get patients who, it can take a long time. Sometimes it's 12 months of intense kind of support and work and other different therapists and specialists involved. But getting them from someone who couldn't go out the house or was having balance attacks that were so severe that they just were frightened of going anywhere, when a year later they are a whole different person, it's really empowering to know that you had that kind of impact on someone's life. So for my patients, I generally will give you as much time as you need. I don't rush things. If you need 45 minutes or an hour of my time, I generally will give you that, even if I've got someone waiting outside, because I will give the next patient exactly the same thing. I will try and communicate in a way that hopefully you'll understand, but I'm also very open to questions and open to challenges. So if you don't understand what I'm saying, I very much expect you to ask. I won't be offended at all, because I find that that's really important. I also think it's a very joint process in terms of the decision making for surgery. Particularly in my area, it is not necessarily life or death. It is a chance at potentially improving someone's hearing, or a chance at improving the intact eardrum perforation, for example. And there are risks, and it's really important to take the time to talk through that with someone and understand for them that may not be the right decision right now, or it is the right decision. It is a two-way street. And that's for me what I feel most valued about my own practice, and I really try and take to every appointment I have. I value when they're honest with me. I really appreciate if they are worried about something when they tell me that, because it's much easier to reassure them and kind of provide the answers they're looking for, rather than not being that way, because otherwise you're always, you're basically create frustration between you if your communication isn't open. And it's really nice to also, if a patient wants to bring another relative with them, I find that really nice and really helpful, because I find that's two ears to listen to all the types of information. It's better for them to then go home and then mull it over. And, they are, when they make that decision with me, it's really useful to know that they've really thought about all that information. And that's why and they give me a lot back, when they're happy and they're smiley and they're their life is different. For me, that's what I value about them. I would say my mantra catchphrase is the decision is a two-way process. It's a two-way street. I'm not just here to tell you what to do. I'm not your parent. It's a joint decision making. And the other thing I suppose I would say is I get asked a lot, what would I do? And I should say my commonest thing I then tell patients is I'm not living with your condition. I don't know how it affects your life. So and I don't also have to live with any consequences if there is a complication. So all I can do is kind of give you the evidence and recommendation of what I could do, but it is a very personal decision. So I would say that's generally the common things that I tend to tell people.